There are some saliva and tear tests out there, but it's not always shed in the saliva and tears, and so those tests, even though they aren't invasive and needing blood, I wouldn't recommend them because you're going to get a lot of false negatives. So in terms of preventing it in your cattery, again, isolate those new cats 30 to 60 days and make sure that you have two negative tests on them before you expose them to the rest of your kids. And test them all yearly to make sure that you maintain that negative cattery state. It's really nice to be able to say, I have a leukemia negative cattery. And then if they respond to you, how do you know that? I test all of my breeders yearly. And before I introduce any new cat, they've had 2 tests. And to be able to tell owners that, that's huge. Yes, it may be expensive initially, but in the long run, it's going to mean a lot more to people that are looking for cats. They don't want leukemia. What about the vaccine? This is a huge hot topic. It's not one of the core vaccines. And if you're testing your kitties yearly, you're doing proper isolation techniques, you probably don't need to get all of your adult cats get this vaccine for them. However, based on what I said earlier about the kittens up to 4 months, those guys are at the greatest risk for getting this leukemia virus. So it is recommended, especially if you're going to show these guys, if you don't know what they're coming into contact with at the shows, using a modified live vaccine and doing it at 8 weeks, 12 weeks, and then repeating it a year later, just because this is when they're most susceptible to the disease. They've actually done some studies that show that they can still have resistance from that vaccine booster that they get at a year of age, that you never need to repeat it again. I've actually, a couple of my cats, I do vaccinate for leukemia. The ones that I don't show, that I know that aren't going outside, I haven't vaccinated them for. But what I will say, this is the only leukemia vaccine I would let touch my cat. It is a modified live. It's not adjuvanted. I will talk about this at the very end. Hopefully we'll have a little bit of time. But this is really important, this adjuvant here. You don't want to use that in your vaccines. You can't give the first vaccine until they're 9 weeks of age. That's what it's labeled for. It does require this vet jet system. And some veterinary hospitals don't carry it. But basically, and there's a newer one than this even, where it's more, and it, like, this one used to make a popping sound that would scare the cats a little bit when they would give it, but it's not really an injection with a needle into the skin. They'll put it along the hip and they'll just kind of pop the end, and it's a disbursement of the vaccine. Instead of being in one spot in an injection, it kind of disperses it under the skin. And it's only 1/4 of a mil instead of a full ml, which is a huge, huge deal.